Well, hi, church family. Pastor Dan here again with Mike Chupp, who's the CEO of the Christian Medical and Dental Associations and one of our BCBC missionaries, and has been for quite some time. Mike, I know you served in Kenya before you assumed this leadership role just last year at the CMDA. And in our previous video, we talked a little bit about some of the storyline of kind of what's going on today with that and how your organization is able to serve healthcare professionals. So in this video, we wanted to talk a little bit about the future and what you see coming down the pike now with, the COVID-19 being our focus today and, likely for some number of months to come still being the headline.
Yeah.
But before we get into all that, the picture that's behind you is kind of interesting. What does that mean?
So this is thank you, Dan, for asking about the picture. This was a picture in my living room at Tenwick for about 15 years. Pam and I liked it. To me, it's Luke 10:2. Reminds me to keep praying for harvest workers. It's kind of an interesting collage of tea pickers in Kenya. And just constantly reminds me, I have meetings here at this table and we're thinking about harvest workers. And we're looking to raise up more harvest workers in healthcare for global and for domestic ministry.
Yeah, absolutely. Okay, so maybe that's how we could divide up the question about the future, domestic and then global. So so in country here in the U.S., what do you see? What's sort of your current thinking on where this crisis goes and how things start to resolve, or what some of the lingering changes in our culture are going to be? I think everybody in the world has an opinion about that, right? But I think your opinion would be kind of interesting to hear, just because of the position you play and the access you have to so many healthcare workers around the world. So feel free to tell us as much or as little of your opinion as you'd like.
Those of you at Barron Center who know me well know that this could go on a long time if Dan doesn't cut me short. But we are at a time. It's literally a strategic time for us. We've worked with the board after Dave Stevens, 25 years at CMDA as the CEO, very powerful. I'll take that hill leader. Mike Chupp comes along, different leadership style. I'm more team-based, collaborative style. And we came up with a new mission and vision actually in January with our board. Our mission is to educate, encourage, and equip Christian healthcare professionals to glorify God. And the way we feel that we'll glorify God within healthcare, and I know many of your docs in your church will agree, follow Christ, serve with excellence and compassion, care for everybody who comes through the door. We don't discriminate. No matter what the LGBTQ lobby says, we take care of everybody. And then finally, by advancing biblical principles of healthcare within the church and throughout the world. So our desire is to, when I came back to the States, I noticed there was this disturbing disconnect. People think that ministry is 9,000 miles away, to serve Christ and to talk about my faith. I got to go on a mission trip. The reality is the world has come to us. They're in our backyard. And so we want to try to help healthcare professionals of faith to integrate faith. And we need to do that from the ground up. We can't afford, Pastor Dan, to wait until healthcare professionals, and the tent has become huge. It's not just physicians and dentists. We have a PA section, a nurse practitioner section. We have physiotherapists, occupational therapists, pharmacists, optometrists. It's just growing because people have seen that we have an infrastructure and they can come underneath. But we desire to help come alongside, educate and equip them, encourage them to live out faith in practice, to break down silos of where their faith is. So we see that happening in a number of ways, not the least of which is our 325 campuses across the United States. We have 90 plus field staff together with our 50 headquarters staff. And I think what I bring that's a little bit unique to the situation is I was in the field for 20 years. And so I've told our field staff over and over again, I've been out in the field and I know what you want from Mother CMDA, and we're going to do our best to provide it for you. And we we're being a little bit like a mission sending agency, but a domestic one, in that we're teaching field staff how to raise up champions and support, and then grow our field staff all across this country, including in some places that are pretty dark. I mean, New York City among them. The Northeast is dark. The West Coast is dark in terms of the gospel. And healthcare professionals still today are at the top in terms of trusted professionals.
Mm-hmm.
So to leverage that influence. And so we've had a curriculum called Grace Prescriptions for some time. Dr. Walt Larimore used to be with Focus on the Family for years. That's been a great curriculum. So in the next 6 months, we want to develop a more contemporary, not DVD-based curriculum, but a phone app-based curriculum that even pre-med, pre-dental, pre-nursing, and then the graduate programs will have this intensive once-a-week course in how to integrate your faith into healthcare. Because what's happening is I think that we've waited too long. We've waited till they become graduates to try to convince them that faith, that living for Christ should be part and parcel of healthcare. They hear through medical school and dental school that those two things don't belong together. And so I think that we, through our staff and through our over 2,000 volunteers in the country today, somewhere between 2,000 and 3,000 volunteer faculty members on campuses, to introduce the fact that it's appropriate, and here's how. Let me show you how. So that I anticipate that this is a third time for this curriculum to be redone, and this time it be phone app based.
Cool. So do you feel like, I mean, one thing I actually appreciate about your answer is I think a lot of people right now are making sort of COVID-19 specific plans, and that's all that's on the table. And what I was hearing in your answer is that your plans are a lot broader than that, really going after the mission itself through this time and beyond this time. Do you see impact in the way that people think of healthcare, or the way that, like the sort of a Christian, we as believers, as we think about how healthcare works, do you see any impact COVID-19 is having on perspectives, or not so much?
Well, let me first say, it's I'm in a different place with COVID-19 than probably most docs are. Keep in mind, in 20 years, I saw malaria outbreaks. I was in the middle of a pandemic called HIV, cholera. These things come and go. I mean, that's just their nature. So I do think we need to learn what God has to teach us right now. But I think we need to remember, I mean, I'm not a prophet per se, but these things do tend to come and go. And so we just need to prepare for what the world's going to be like when it's gone, just like the Spanish flu came and went in 1918. And I think, our strategic planning consultant said to me, Mike, and he's been doing this for 40 years, membership associations, they're dying everywhere. Millennials don't care about joining things. But I think maybe CMDAs right now, because of COVID-19, it's different, because looking for a national organization to support, come alongside, and help during difficult times. So we've pushed the pause on our strategic planning process, because we know that our members, we have 19,000 members. We know they're distracted right now by this.
Yeah, absolutely. So on the global front, I guess I'll ask you one question kind of specifically about COVID-19 globally, and then ask about your organization. But something I keep hearing in different news outlets is that the developing world, hasn't been hit with the same intensity of a wave, or they can't afford the testing that would tell them they're in one, that the developed world has right now of coronavirus. Do you see, like, when, for example, India or countries in Africa lift their lockdown, do you feel like there'll be a big surge, or do you feel like, you kind of say like the Spanish flu, like it'll kind of have come and gone, or is there really any way to know that?
Well, thank you. because your question is causing me to think about, I mentioned earlier that I'm a different kind of leader in collaboration. I also, because of my position, am on the board of our international umbrella organization called the International CMDA.
Mhm.
That organization is linked network with over 100 nations, movements just like the US CMDA. And we've had an opportunity. I certainly do my best in this position to avoid any politics because we've
Yeah.
got people all over the place. But because of what happened, the administration decided with WHO, we've been approached, and then we approached our umbrella body internationally, and we've been in conversations with USAID and the White House about how we can help facilitate the US government in making a difference around the globe with our networks because of relationships that have been developed over 70 years around the world, how we can make an impact in COVID-19 globally and build up infrastructure of mission of church and faith-based hospitals all over the globe. And so Dr. Peter Saunders, who just happens to be a former surgeon as well, is running that organization. And we have been with some of the highest, we were with in a Zoom call with the highest official at USAID Global Health Department, talking about a plan. And you brought up India, I think, and already the infrastructure, there are over 500 church and faith-based hospitals in India alone. That's just one country in South Asia. So those countries, because of the work of missionaries from the late 1800s, they now have their own movements. And so we are working together to represent Christ, locking arms across countries. And it's honestly, Dan, it is a privilege for CMDA to kind of take a low profile role in this and to lift up our international partners in this and to help come along, bring some resources as we're able. I sometimes wonder how far stretched the US resources are really going to go in all of this, but there are opportunities that we have to say. It's said that the Chinese word for crisis also has two figures, and one of those has opportunity built into it. Has opportunity, two different Chinese figures. So we really do see some opportunities here. We know that God's up to something big, and we just want to keep our eyes and ears open to understand what those opportunities are and not miss them in coming months.
Yeah, absolutely. It's such a unique moment because even though you might say in world history there have been bigger or more deadly things that have happened, this is a shared experience with almost everyone everywhere. The shared experience of lockdowns and economies slowing or being paused, and the fear of a new disease or whatever. But the fact that it's not just one country or one region, but it's really everywhere simultaneously is, like you said, as a crisis, but also so much opportunity to.
I'm on WhatsApp, Dan, and
Yeah.
every morning I get messages from 10 different countries. Unfortunately, they're like 8 to 12 hours ahead, so they start about 2 in the morning. but all these messages from secretaries, Christians who are heading up major movements, and what God is doing, the collaboration that's global. I mean, it just seems like it's preparing for Jesus to come back. It's an amazing technology that we want to leverage for His glory.
Yeah, right. So for mission groups that do have a medical aspect to them, or they run a mission hospital, is it a matter of them? Do they come to CMDA website and join somehow, or how do those partnerships grow? And if someone was not currently associated with you, but they wanted to be a part of things, what's their path forward?
They can go to our website, cmda.org/membership. If they're an American-based healthcare professional, if they're students or missionaries, it's an electronic free membership. So there's no annual dues. If they're practicing in the U.S., there's a dues level. We've recognized that these are hard times, and so we're trying to be liberal with dues grace. But international partners who do electronically, those overseas nationals, we have lots of our members who are from Africa, developing Africa, nationals who join for free also.
That's great. That's neat. Um, well, let me give you the last word here. Two questions. One, anything else about the future that you want to just either speak as a word of encouragement or challenge to the church? And then secondly, as we think about you personally, your family, how would you like us to pray for you in the weeks ahead?
Thank you for asking that question. Um, I've got a lot of prayer warriors there at BCBC. There's no question. We've felt your prayers. God has always been Mike Chupp's recruiter. And without that recruitment of the Holy Spirit, I'd be dead in the water. He's brought me some incredible leaders. He brought me a senior vice president just in the last 3 weeks to head up our bioethics and public policy efforts, which was weighing heavily on me. I shared before we started this interview that we're in the middle of a case that's likely to go to the Supreme Court in the next 1 to 2 years. It's at the appeal level now. Basic defending the rights of healthcare professionals to be able to refuse to do things that they absolutely know are morally wrong, like abortion, euthanasia, and so forth. And so just pray that we will stay the course, and that when opposition comes from the enemy, that we'll be faithful, and we won't cower. We will be strong and courageous. And also pray that we'll figure out, right now we're kind of in limbo. I had a new director for my Center for Advancing Healthcare Missions, all selected. He had accepted the job, and then COVID-19 came. And he works in urgent care up in Milwaukee. In fact, I have a phone call with him in about 15 minutes. He was going to come on board. We found resources to help support him. And then he's desperately needed in Milwaukee because they have a high incidence of COVID-19. Mm-hmm. So I'd pray that God will continue to bring the team here together. And I want us to be raising up harvest workers and having an influence. And one of my young Kenyan doctors at Tenwick in the last couple of years before I went, she said, "Oh man, this appointment is perfect for you, Dr. Chupp. You love to recruit people to come join us at Tenwick. Now you can recruit for lots of different missions and hospitals." So that God will, my request would be that God will continue to use us and anoint us, our 50 staff here, 90 some staff out there, to call out his people and to realize that risk is right. Risk is right in service for Christ, and that we die so that others may live. And for Pam and I, in the midst of this, we had a wedding. In the midst of all this COVID-19, our family's doing fairly well, but like other families, had all kinds of things. My youngest is graduating from high school in 3 weeks. And seeking God's plan for her life. And I've got a new son-in-law. So Pam and I are probably going to, God willing, do a whole lot of travel this fall and get out there and visit a lot of our schools and area ministries, and maybe even do a little singing, so that we just pray that God will open the door for us to do what I think God has equipped us to do, which is to engage with people and challenge people to answer God's call.
Amen. That's great. Well, we will be glad to lift those things up in prayer for you. And thank you for taking time to hang out with us as a church here. And we so appreciate what you're doing, and that God has arranged things in such a way as that, for such a time as this, right? That even though the world is under stress, and particularly the medical system is under stress, it's neat to know that Christian Medical Association is there, networking people, encouraging people, and keeping God's kingdom at the forefront. So thank you for being a part of all that.
Thank you for asking me to talk with you today. I appreciate it. It's a big encouragement and I will share this with Pam big time.
All right, great. All right, well, God bless you, and we'll talk again soon.
I hope so.